So, welcome again to the Reflective Practice for Aspiring Psychologists workshop or webinar, which is delivered by myself. So I'll also just do a little introduction. My name is Melissa. I'm a final year trainee counselling psychologist. I'm actually about to qualify in a few months, which is very exciting. I was an assistant psychologist previously. I had 2 AP roles before getting onto the doctorate. I also have a career coaching kind of service, I guess, that I support aspiring psychologists in, securing AP roles or getting onto a doctorate. I've been really fortunate recently to have been able to do this for quite a few people. So today is really just about being able to share some of the knowledge that I do within my kind of one-to-one coaching services, because reflective capacity, especially my interview prep that I do with people, comes up quite a lot. So I really hope this is going to be helpful for people. This is the second webinar I'm doing as well. So, I'm still probably going to be a little bit rusty, but any feedback is really, really appreciated. So yeah, let's get started. So just a little agenda for today. So we'll just go over some definitions. What is reflection? What is reflective practice? That will be really quick. We won't spend too long on that. And then we'll go into a few models and theories, specific reflective models and theories. I'll also talk a little bit about how you can actually build up your reflective practice, whether it's just on your own or within a workplace. And then I have like a case vignette and a case example, not based on a real person, it's entirely fictional. But we can maybe do a little practice if people want to partake in it, or I might just, kind of say my ideas on how I might reflect on the specific scenario. Just so you can kind of start working those reflective muscles a bit. And then we'll go over a few sample reflective interview questions. So we're not going to go into detail on how to answer each one, but more so like these are the types of questions that might come up in an AP interview or any interview within a mental health service that you might think, or probably that you should be thinking about demonstrating some reflection in there. And then I also wanted to bring in the STAR method, which I think everyone is really familiar with in terms of interviews or interview answer frameworks. But it is a really good one in order to weave in reflection at the end. So I wanted to touch on that a little bit. And then a Q&A at the end. So we'll see how we do on time. And yeah, just quickly, webinar is being recorded. So if you, have your cameras off, if you don't want to be seen. All right. So what is reflective practice? So I took a definition from Findlay, who is a qualitative researcher, but is also a counseling psychologist, I believe, or practitioner psychologist. I could be getting that wrong, but she's in the psychology space. And the way she defines it is learning through and from experience towards gaining new insights of self and practice. So it's effectively, you're kind of just thinking about these different experiences that you've had and looking back, but then also thinking about how can these experiences bring new insights of myself, but also of my practice. So we'll go into a little bit more detail around this, but this is the definition overall of reflective practice. So why does reflection matter? So let's go into the important bits. So these are the main 3. There are probably a lot of others, but these are the ones that just came to mind for me. So reflection, especially within a psychology-oriented role, but honestly, like even just everyday life for anyone, I don't think you need to be in working in mental health in order to be able to really utilize reflection. But one of the advantages of it is it can really help you process difficult experiences and also recognize what when you're struggling. So, when you really take a moment to sit and really think, okay, I've had this experience, it made me feel a certain way. What was kind of going on there? Why do I feel like it made me feel this way? Um, and then you want to take that kind of a step further, be like, okay, it made me feel this way. Now, maybe what is it that I need in order to, bring in a bit of self-care and, what can help me progress from this difficult experience? So, you can translate that to your clients that you see or that you work with within any service. But again, yeah, you can also transfer this over to your personal life as well. Um, I think what's also quite useful is that it can really help you identify what drains you versus what energizes you. Uh, so what I mean by this is there might be certain clients that you kind of notice, like when I work with these sorts of clients, like I just notice that I feel really tired as opposed to other clients where I find that maybe I feel a bit more excited about the work or energized. It's not to say that because they drain you that you like, oh no, like I can't work with them, but it's more to spark that curiosity, like, oh, I wonder like what's happening there that they're draining me, as opposed to maybe another population that might energize me. um, and another aspect is just to kind of maintain perspective, I guess. So rather than being too deep, or not too deep into something, but if something has happened, rather than kind of having a tunnel vision on it, it kind of requires you to take a step back and look at lots of different aspects of this particular situation. So this is for you. This is why reflection is important for yourself, but it's also very, very, very important for your clients. So reflective practice is actually a core competency for the BPS, if you're a practitioner psychologist or you're a chartered psychologist, sorry. Because what it does lead to is more thoughtful practice. So, you know, if you kind of just go into your sessions and, let's say you're doing CBT, like, okay, we're going to do CBT, we're going to do the structured interventions, and then end of the session, that's that. Like, yes, you can do that. And I completely appreciate if you're in a service that is, you're just totally strapped for time, your caseload is so big that, maybe it is going to be like that. And that's a systemic issue. But, if you're kind of doing that and that's not the case, you're really missing a lot of opportunity to improve any mistakes that you might make. Maybe you said something to the client, and then looking back, you start wondering, like, oh, I wonder why I said it in that particular way. Or like, I was, feeling a little bit, uh, oh, like I noticed in this particular intervention, like I didn't really say it in the best way. Uh, and then, with that in mind, you reflect on it, and then you think about, okay, maybe I'll do a little bit of reading on this intervention. Maybe I can practice it in a role play, just to kind of support my development there. So it's really, really important for your clients. And it's like an ethical obligation, actually. Um, and then, yeah, for your own development. So, I mean, this is kind of similar to for your well-being, but more in relation to skills. So, you can effectively turn any experience into learning, and it's going to continuously help you to improve and build your confidence. Um, and yeah, most importantly, it helps you identify what it is that you need to learn and improve on. Um, so, not even with your clients, but let's say you're in a team, you're in a multidisciplinary team, and you're noticing, like, oh, I'm working with a psychiatrist. The psychiatrist they really make me feel a certain way. Maybe the way they talk about patients, the way they treat other members. I'm just using psychiatrists as like a random example. Nothing against psychiatrists, obviously. But that kind of sparks up something. It's like, oh, why? What is it about this particular person or this particular profession that maybe makes me feel a bit more defensive? And by reflecting on that, it can actually support just your ability to work in a team as well, because you're always going to be working with people who maybe you don't agree with, or you don't necessarily agree on their approach to patient care. So, but you have to work with them, and reflection or any reflective practice supports in being able to do that. So, what influences our practice? So, we will touch on a few of these, especially the social graces I will bring in later. But the reason why it is important to engage in reflective practice, especially in something like psychology or or any kind of mental health profession, is because so many different things can impact it. So our own experiences, the way we, our personal beliefs about mental health, or our cultural background. How does our culture or our, where we grew up, how do they really think about mental health? Any past trauma that we might have, or any past difficulties, these can all, even in very, very subtle ways, they can all impact the way we might speak to our clients, or the way we might even formulate or conceptualize them. So, um, uh, I'm just trying to think of an example, but I think it will be a bit more clear when we look at the social graces model later, which is a very important model. So we'll touch on that. And then, of course, cognitive biases. So, things like confirmation bias. So we see what we expect to see. So this tends to be a problem in particular with, like, for example, women being diagnosed with borderline personality a lot more than men. This was the case at one point. I'm not sure if it's still the case, but from my last kind of reading into the research on this, it seems like it still was. So, you might have a male and a female presenting with the exact same symptoms, but the female will be diagnosed with BPD and the male won't. So obviously, there's probably a lot of reasons as to why that might be, but maybe one of them could be that cognitive bias that, because we sort of associate maybe the term BPD as something more female oriented, which is unfortunate. That might influence our practice to maybe, like, once we're qualified, we might give someone a diagnosis based off that if we're not careful and if we're not reflecting on our own cognitive biases. The other one is, I think it's called like a similarity bias. So, relating better to people who are kind of similar to us, and how that might impact the way we speak to them, the type of care that we offer them. And sometimes it can go the other way. Someone who's very similar to us, there might be a bit of distance there, maybe because of some of our own things. We might be projecting that onto the client. So, again, just so many different aspects to consider. And then the work context. So, again, what I mentioned before, like time pressures, or staff shortages, or maybe previous experiences that we've had with a certain population. These all impact the way we practice. So, I'm even just thinking when I in my training, in my counseling psychology training, when I was juggling 2 placements at the same time. I had a much higher caseload, and you notice that it's not that the quality of your care goes down, but you just notice a bit of, like, okay, yeah, we have this session, and then after the session, I have my next session, and you're just not able to engage as well as maybe you would if, you just had that one session, then you had a break after, and you can, kind of simmer in what happened. So yeah, a lot of different things to consider here. And I think it's also important to say that you're not going to be aware of all of them. It's impossible. But if you can, start practicing and start being aware of some of maybe the key things that you've noticed, even recently, That's already a really good starting point, especially if you're, en route to the DCLIN or another psychology doctorate. So this is kind of similar to what I mentioned before, but I did just want to include it because we will go into some models of reflection, like reflective models, but in the core of reflective practice is these three things. So, let's say you're in an interview or something, or you're engaging in supervision. It's okay if you're not drawing from a model very precisely, as long as you've covered these three things, you're engaging in good reflective practice. So any reflection or reflective practice needs to involve that retrospection. So you're looking back. That's where we start. We're always going to be looking back. We're going to be recalling a past event or an experience. You might want to bring in some details like, okay, who was there? What was I doing? Who was I with? What service was I working? A bit of context, that always helps. Just to contextualize things. And then the self-evaluation. So this is then where you examine your behaviors, your emotional responses. And sometimes you can do this through the lens of relevant theories. So, you might want to think about, like I did this, like I was feeling this certain way, and then I did this. And, why? Why was that the case, actually? So, you might want to bring in something like, you could bring in the CBT model, for example, how you notice that you had a particular thought and then this made you feel a certain way and then this made you behave in a certain way as well. So sometimes it does help to bring in that psychological theory into it, just to kind of anchor and make sense of the experience a bit more. But you don't necessarily have to. It does help, though, especially in interviews, I think, to be aware of some of those theories. And then again, I think they're all really important, but reorientations may be the most important. So the retrospection and the self-evaluation is it's not enough. It might be nice just as like a mental exercise, but in practice, if you want to become a psychologist, if you want to work clinically with people who have mental health distress, you have to learn how to orient this experience into the future. So you need to apply the insights gained from the self-evaluation to shape how you might handle these comparable situations going forward. So again, it's not just, okay, this happened. It's, this happened. Now, what am I actually going to do with this? How is this going to change the way I work with my clients, or how I work in a team, or how I formulate clients? So especially in interviews, you need to be bringing in this part. We will go into some theories now and into some models, but I really want people, like, if there's one thing I want you to take away from today, it's this. Like, this is the key sort of formula and process that is going on in reflective practice. So the first model that we have, I'm sure people are aware of it. I think it's the one that tends to come up quite a lot. I think they bring it up a lot in supervision. I don't remember this ever, or any models actually coming up in my undergrad, but that was a few years ago, so maybe things have changed. This is the Gibbs reflective cycle. So if you want a framework to start thinking or reflecting about an experience, we can start here. So just a description, what happened. Keep it very factual. Don't bring any of your own interpretations. Just, this happened, I'd be able to see it, you'd be able to see it, no one would be able to kind of dismiss or reject this description because it happened. And then we can bring in, what were you thinking and feeling? So again, we don't need to think about why, just what was coming up. Was it frustration? Was it anger? Was it like an impatience? Were you kind of thinking like, oh, like maybe it's if it's with a client who is really resistant to treatment, is it maybe like, oh, like, it's so frustrating that they're not engaging properly, and maybe it makes you think, you kind of wonder like, oh, maybe this might, this spot on my case, it might be better for someone else who wants to engage. That sounds really harsh, and uh, I think everyone might think this at a certain point, but again, it's what you do with that. So rather than kind of trying to dismiss and be like, oh no, like I would never think something like that, it's more owning it and thinking like, oh yeah, okay, I did think that, but now what? Um, so then you go into the evaluation. So what was good and bad about this experience? So, if you've got someone who's resisting to engage, what, and they were kind of verbalizing that to you, you might think, well, what was good and bad? Maybe what was good was the way you approached it and the way you kind of spoke to them about it. Or maybe that's what the bad thing was. And yeah, really just being honest with yourself. This might be hard to do at times, but it's really important. And then what sense can you make of it? So, you might want to go deeper here and think, well, okay, if I am getting frustrated with a client who's not engaging, why? Why is that the case? Is it maybe, again, the service context and the systemic context that we're in, that, there's staff shortages, the caseload pressures are just ridiculous. Maybe that's causing a lot of anxiety, and, maybe that's contributing to this frustration that you might have. Or, depending on the presentation, maybe it's something personal about the client that brings up something in you. So you can really go in all sorts of directions here. And then what else, in the conclusion, what else could you have done? So this is where you, kind of reevaluate. So could you have said something else? Could you have approached things in a different way? And then your action plan, what are you going to do next time? So really, really important. This happened, now what am I going to do in the future if something similar like this happens again? So this is quite a nice framework, I'd say. I feel like it covers all the main bits. It's very similar to this sort of process again. It maybe just kind of breaks it up into different or more steps. So if you work in that way, if you like that sort of thing, I definitely recommend this particular model for that. And then we have the Rolf, Freshwater, and Jasper model, which is just the what, so what, now what. So this is the one that I think was really popular at one point. I feel like I don't see it as much anymore. But when I was applying for doctorates and applying for AP roles, I was seeing this one a lot. And I think it's just nice because it's very easy to remember. So, you go into, again, description of the situation and what happened. And then you go into the analysis and why is this significant? So it kind of skips a little bit, just sort of naming those thoughts and feelings, which is okay. I think, again, it's going to be personal preference. But then at the end, we go into the now what. So again, really important, future action and learning. How is this going to inform future practice? So this one could be nice for interviews as well, actually, because it's quite snippy and it's quite kind of catchy in a sense, like what, so what, now what. I think it's very easy to remember. Yeah, it's quite a brief one, but again, this is all going to be personal preference. So maybe it's actually important to say there's no kind of right or wrong way to reflect, as long as you're covering the main bits that I spoke about before. And then we have the social graces. So this is going to be quite different. This one doesn't really go into, it's not really a framework like this one or the previous one, where you describe what happened, you're thinking about your thoughts and your feelings, even though it would be interwoven into that naturally. But this one is a lot more, I guess, kind of specific to thinking about how things like race, gender, age, ability, etc., how these aspects, or all these different aspects of your identity, might impact how you are with your clients, and depending on what aspects of what identities the client has as well. So I will give an example. And just to preface this as well, the Social Graces tool was originally a tool developed in social work, but it's now been sort of adopted by psychology, in particular within the third wave systemic therapies. So this is a tool that you might use if you're working with someone systemically, especially on an individual basis, to kind of support their understanding in, why have certain things happened to me, or why have certain things, I guess, kind of occurred based off my different identities. So I will give an example. This is one that I think is really important. I think everyone should be familiar with this at some point. If you're applying for a doctorate, whether it's a DCLIN, educational psychology, counseling psychology, I think this is crucial to know, because the social graces will come up during training, and a lot of institutions are adopting it now as well as a way of supporting practitioners' reflective capacity. So I'll give an example. So my social graces, so my age, I'm 28 years old, I'm white presenting, my gender is female, and I'm cis female. So those are a few of my social graces. So if I'm working, well, firstly, actually, the way I might conceptualize mental health, or the way I might think about mental health, might be quite dependent on some of these. So for example, age. So, I'm 28 years old. The way I might think about mental health is different from someone who is maybe 60 years old. So even that social grace in itself, you can already see like how much weight that will have in terms of how we might think about clients, actually. So not just mental health as a whole, but clients. So let's say I'm working with someone who is, let's just use the same social graces again. Let's say I'm working with someone who is 60 years old, and they're white British, and they're male. So this might bring up a different dynamic compared to if I was working with someone who is, maybe 20 years old, who is Black British, or, Black American, and a male also. So there's a lot of different dynamics you'd think about. But if we take that first example, let's say I'm in a room with someone, who's a male, white British, 60 years old. Depending on the interaction, and I'm making a generalization, but I think it's an important one to make, just to kind of make my point. But there could be a little bit of a power imbalance there. So someone who's a lot older than me, who is also a white male, even though I'm the practitioner in that scenario, it might bring up feelings of like, oh, maybe I feel like I really need to prove myself here. I'm working with someone who's who's a lot older than me, I feel like I really need to know my stuff, and sort of show them that I'm really, really competent. I feel like that happens a lot, especially at the beginning of training and when you're newer in psychology. Um, but that doesn't have to happen all the time. So, some people might not, uh, they might not experience that at all, but maybe that's something that might have come up for me. So I guess what we're talking about is power here. So how does power operate between my social graces and a client's social graces? So in this case, the client might have a bit more power here. But then actually, if we look at another social grace, which is employment, uh, let's say I'm a psychologist, I'm the psychologist within this space. And let's say the client is unemployed. So that brings in another dynamic there where actually, maybe I do have quite a lot of power here, even if, some of these other social graces there are kind of, maybe the power is more on their end. There's still something here. So again, then you'd start thinking about, well, what does that bring up in me? Do I feel quite powerful in this scenario? If I do, what does that look like? Does it make me feel good? Does it make me feel bad? If power is being exercised there, how have I exercised it? So, if I'm doing CBT, have I brought in an intervention really just kind of like, we're doing this intervention as opposed to being collaborative with the person? So you can spend a lot of time on this, actually. I hope I've made that clear. I'm obviously happy to kind of take any questions at the end. But in summary, and to put it simply, you can use this tool to explore your own social graces and all your different identities and how they might impact how you work. But you also want to look at your client's social graces and how they might interact with yours. So that's the kind of summary there. So, learning from mistakes. So mistakes happen. You will be making a lot of them throughout your career. I think it's important to say that because I think, again, especially if you want to get an AP role, you want to get onto training, even when you're on training, you're gonna be making mistakes because you're learning and it's part of the journey. What's important is if you do make a mistake, you need to acknowledge it and again understand what led to it and take responsibility. So, I'll take quite a big example here, or maybe sort of big mistake, but let's say, there was risk and you forgot to document it. It's really, really important to document it. Because, different services, you need to be able to track risk across the trajectory of a client's care. And that if it hasn't been documented, we can't do that and it compromises client safety. So, if you didn't do it, rather than, kind of pretending like, oh, yeah, no, I don't want to get in trouble, just own it, take the responsibility, learn from it. Again, do something different next time. So make sure you do actually document it. But then also think about understanding, what led to it. So if you didn't document it, why do you think you didn't? Is it like maybe you just didn't know you had to? And if you didn't, is that maybe because you haven't received enough training, or nobody's told you to do that? So if you know what led to it, then you can address it. So if it's a lack of training, then it's time to bring something to your supervisor and ask, like, I think I need a little bit more training in risk, actually. Or if nobody told you, even asking your supervisor, like, okay, in my next supervision session, actually, could we take a moment just to go over what am I meant to do if risk comes up? Because I really don't know. So even like mistakes that seem quite big on face value, even if they are big mistakes, you're going to be a lot worse off if you sort of pretend it didn't happen, or you start judging yourself for it rather than, just taking a moment and being like, okay, like this happened, but like nobody actually told me. I hadn't received any training in it, but now I know that this is something that I need to do. And you really learn from that. So you can apply that to anything. And again, reflective practice is something that is a very good opportunity to start learning from your mistakes. So you could take the what, so what, now what framework, for example, and even think about that scenario, like, oh, I didn't document the risk. What happened there? And it's all in the pursuit of becoming a better practitioner now and in the future. So reflection and self-care. So I did touch on this a little bit, but reflective practice is a good way to just sort of keep on top of your self-care. So I put some questions here just to kind of support that. So if you're trying to really boost your reflective practice a bit more, you might want to think about, am I looking forward to work, or am I dreading it? If I'm dreading it, why? Is there maybe someone at work, or actually is the work just not what I want to be doing? Am I sleeping well? Am I able to switch off outside of work? And again, am I maintaining boundaries? So these are all quite important questions just to ask, like, actually, are things okay? Or if I am just feeling really tired and really burned out, you might want to think about these questions here. Again, just to support yourself, which again is going to be very, very important from the beginning of your career. So even if you're like a support worker, a healthcare assistant, all the way up until you finish your training and even beyond that. And then, asking what's energizing me, what's draining me, am I looking after my basic needs? Do I have support outside of work? So yeah, just more guiding questions to support your reflections in yourself, especially if you just start noticing that you're just maybe feeling more tired, or you're just you're maybe not enjoying work or anything else, actually. So how do we build reflective practice? So a good way to do it is through a reflective journal. This is one of those things that I remember someone, I can't remember who told it to me, but I think it was multiple people. Like, multiple people would say, like, yeah, keep a reflective journal. And I, to be honest, I didn't. But now in hindsight, I can actually see how much value it does have. Because I think before I got into training, even like before I got an AP role, I was quite just a bit more like, I would do all the reflection in my head, but sometimes just writing it down on paper, it's just so much more comprehensive. There's something about the act of like getting pen to paper. It also makes it feel like you're really devoting the time to this, as opposed to like, I'm just on the bus and I'm like, oh, I'll do a bit of reflective practice in my head. It doesn't really feel the same. So I would really recommend doing this, even if it feels like, oh, it's just like something else to do. But you can be creative with it. You can have something on your notes app. You can do voice apps. I think Apple also has an app, like a journal app or something, and you can do voice notes in it. So that might also be something nice. And then supervision. So supervision is definitely somewhere where you would be bringing your, if something has gone wrong or if something has gone well, reflecting on that. So reflective practice has actually been a huge part of my supervision experiences on the doctorate. And in my AP role as well, just because it's really important for all the reasons that I mentioned before. And another way, which I think this isn't as common, they don't have these everywhere, but they do have them when you're on training, are these peer reflection groups. So um, it could, yeah, peer reflection groups or peer reflective practice groups. So if you're in a service, they might have like monthly reflective practice sessions. I'd really encourage you to go to those. Even if you're not going to bring anything yourself, you might just want to attend just to see what it's like for people to kind of think about their clients, think about the way, uh, not, you know, not what's troubling them, but, you know, reflecting on difficult experiences that are maybe happening at work. It might just give you a bit more confidence as well to bring things in. Um, and then regular CPD activities. So, you know, even like a webinar like this, you know, just to, even though we're not doing active reflection today, on like our own personal things, it might just kind of prompt you to think about your own things that might be going on, whether it's at work or personal life. Um, and I think maybe what we should be clear on, especially with the peer reflection groups, is that uh, a reflective practice group is not group therapy. So I think that's where it can uh, the line can be a bit blurred there. Uh, but you know, if in these peer reflection groups, you're not going to be bringing in your, you know, your deep traumas and sort of processing them in that group. That's not what it's there for. Especially in a service, you would be bringing more around what work related difficulties and, you know, having the kind of peer support around you. So just to make that clear, because I know that depending on the group, sometimes it might border more into group therapy, but that's not really appropriate. So if you want to start engaging in reflective writing, here are just some ideas. So, you know, if you're a support worker, healthcare assistant, or AP, you might just think about what are some significant moments in the day, situations you found difficult, or things that surprised you, or just overall feelings about your work. Um, so, you know, just pay attention to yourself and sort of how you're feeling, I guess, throughout the day, and pop down anything that you notice. And then how to write it. So, I mean, it doesn't need to be perfect. You know, again, nobody is going to read it. So, you know, you can be really rough with it. You can use a reflective model if you want for a bit of structure. And most importantly, just end with what you'll do differently, because that's going to be the learning uh, outcome, let's say, of your reflection. And then, of course, you know, if you're reflecting on client scenarios and you're writing things down, just be sure to anonymize. You know, obviously, no one else is going to read it, but by some chance, if someone does read it, yeah, just don't use any real names or any identifiable details. So, this is a case example, uh, fictional again. So I will read it out and I will maybe, I'm trying to think, maybe timing, we won't have time for like a group sort of exercise on this, but I might just sort of suggest some of the different things that might come to mind for this one. So you're a healthcare assistant, a patient, male, white British, 60 years old. Oh yeah, I must have got, that's what I used for the social graces. I must have got it from here unconsciously. Um, a patient, male, white British, 60 years old, you supported for several weeks, is being discharged tomorrow. You've built good rapport and feel pleased about their progress. During your shift today, they gave you a heartfelt thank you card and a small gift. You felt touched, but also a bit uncomfortable. You're not sure if you're allowed to accept it. You kept the card, but left the gift at the nurse's station. So there's quite a lot here. I think so. Yeah, we're doing like a raw reflection now. So, what questions might I ask myself? I think the first thing I would ask is, what made me feel uncomfortable here? What made me feel uncomfortable around receiving a thank you card and a small gift? So if I really think about this, I guess I think about, there is this idea how in services you're not really allowed to accept gifts, or, you're not allowed to accept gifts over a certain monetary value. Um, that's the first thing that would come to mind for me. I think if I were to feel uncomfortable, it would be that. It would be this, oh, like, I'm not sure, like with boundaries, is there something, maybe I shouldn't be accepting it? Um, and maybe because of that, then I might, I keep the card, which is something more personal, but then I leave the gift for someone else, or for the rest of the team. Um, but maybe depending again, obviously there's a lot of details that we don't know about this case, but was there maybe something, again, it will depend on the patient's formulation, but was there something around them maybe crossing a boundary of some kind? And has that been a pattern for them where they try and, maybe ask questions about your personal life, or uh, they try and get to know you outside of the work scenario? And is that something that maybe did that make me feel uncomfortable? Or was it something around the social graces? So, I'm a young female, this is an older white male. Was there kind of something, is there something there that maybe felt a little bit inappropriate, and that maybe that's why it made me feel a bit uncomfortable? Um, so I'm trying to think of everything else here, but I think this is the main question I would be asking. Like, why did I feel uncomfortable? Um, and then also, like, why did I not keep the gift? Again, does it have to do with like maybe a service policy? Like, no, we're not allowed to accept any kind of gifts. Um, but I think if in this scenario, maybe what I might do differently if I was this person, or if I was in this scenario, I think the first thing I do would be to actually take it to supervision. One, because it made me feel uncomfortable, and two, because it's one of those things where, oh, actually, I'm not quite sure what I'm meant to do here. Should I keep it, or should I share it with the rest of the team? Because even if there is a service policy around not accepting gifts, there is also something to be said around, kind of maybe being a bit disrespectful to the patient, especially if you've built up a lot of rapport with them, you feel good about how far they've come. There's, there's maybe something there around like, oh, why wouldn't I accept the gift there? Um, so yeah, quite a few things. So I guess, yeah, in terms of what questions might I ask myself here? So sorry, that was a little bit more of a more of like a free flowing kind of thinking, I guess. But the questions I'd want to ask are, what social graces are maybe at play here? Why did I feel uncomfortable? Uh, what would I do differently in this scenario? So maybe would I not leave the gift at the nurse's station? Maybe just keep it for myself. Would I do that? I don't know. Um, and I think also, how do I feel about the client? Uh, and maybe is some of that discomfort down to maybe I'm actually just really going to miss them. So there again, there's just so many different things. I think it's going to be really personal depending on each person. But yeah, those are some of my reflections around this. So, sample interview questions. These are just four of them, but they tend to be ones that you might see in different roles. So, tell us about a time something went wrong. is probably one that comes up, not in every interview, but in a lot of interviews. It's one of those core questions. So this is a real golden opportunity to be able to showcase your reflective capacity, because you're not just showing that you're thought about what went wrong, but you're also showing, okay, this went wrong, but then now I'm going to think about how to move forward. This is what I learned, and this is what I would do differently. And then similarly with the second question, so tell us about a clinical case you worked with and what you learned. So again, you would bring in the description of the clinical case, anonymize it, of course, and you might want to bring in a difficult experience or something positive. But again, most importantly, what came up for you and why do you think it came up? And how would you handle things differently in the future? Or what did it teach you about working with clients or working with this client? So again, you're using that sort of formula, I guess. And then what are your strengths and areas for development? So here's maybe a little bit different. Like, you might not necessarily use a reflective model. It would be more kind of listing out, like, yeah, these are my strengths and these are my areas for development. But I think the point is that when you're talking about areas for development, especially, you need to be reflecting on your experiences in order to even arrive at these. So when you get this sort of question, especially like, what are the areas for development, you would be, telling them like, yeah, I think I need to work on X, Y, Z. But you don't just leave it there. You think about how will I work on it, and how will I work on it in the future so I can improve my practice. So you're always thinking, it's almost like very problem solving. Like, you're never just kind of giving them a reflection or giving them something about what's happening now or what happened in the past. It's always, how can I take this into the future? And that would apply here as well. And then how would you manage your biases and assumptions in your clinical work? So this is where like social graces might fit in quite nicely. And again, you might not use a reflective model. You can if you want, but it would be more so like, in order to arrive or be aware of your biases and assumptions, you have to engage in reflective practice. So like, let's say you're prepping for this question, and you're anticipating it to come up in an interview. You might want to look at your social graces and see how they might interact with the client that you're working with right now, and noticing like, oh yeah, like, is there maybe a bias there based off my gender or based off my race? And again, how would you manage that? So how, like, this is what's happening, but how will I manage it and improve for the future? So yeah, that's pretty much it in terms of sample interview questions. Obviously, there's a lot more, but there's there's a million other potential ones, obviously, but these are some of the core ones that I've seen come up, especially in AP interviews. So I wanted to bring in the STAR method because I also realize we might go over time a little bit, so I'm sorry about that. But I do want to kind of bring this in because the STAR method is it's actually a really good way, or it's a good answer framework in order to weave in some of that reflection. Because if you see, so Claude helped me make this nice little flow chart because I was struggling to make it on PowerPoint. But it's quite nice because it does go into a little bit some of the reflective models that we looked at. So, at the beginning, you're setting the scene, the description, what happened. So, you set the scene briefly. What's the context? Who was there? What was the setting? So you're giving the context, you're giving the situation to the interviewer. And then what were you responsible for? What was expected of you? And what was the challenge? So here we're really naming, okay, what actually happened, and what did I need to do in order to address it? What was the responsibility that I had? And then in action, you would think about, what did I actually do, and why did I do it? What was my thinking at the time? So again, you're kind of bringing in that. It's a little bit more descriptive, I guess. You're still kind of staying within the reflection and the kind of retrospection part. But yeah, just being a bit more specific. So especially like, who did you consult, and being really explicit about your decision making and why you did the things that you did, which again, you can only really understand if you've reflected on it. And then in the results, so obviously R in the STAR method stands for result. I think what you could do is, it could almost be like result/reflection. So at the end, you would think about the outcome. What did you learn from this experience? How has it changed your thinking, practice, or approach? If you want, can you connect it to a model of reflective practice? So maybe like social graces. So the STAR method, if you've got an interview question, especially if it's more of a scenario question, like tell us about a time something went wrong, this is a really nice framework to use, because it does actually cover everything that you need that needs to be covered. And the results section naturally fits in very well with kind of bringing in that reflection and that evaluation. And again, how will you kind of improve for the future? So I know everyone's really obviously familiar with this model. Everyone knows it for interviews. But just to kind of highlight it further, because I think it's really good for these types of reflective questions. And that's pretty much it. So I've got a QR code here, for you can check out my website. I have a lot of different resources. You can also check out my blog. I've got different guides for AP applications, for Deacon applications, and for the counseling psychology doctorate. I also just launched an application, AP application workbook, which covers some of the things that we spoke about today. And that's available on my website, so you can scan the QR code for that. And I will take some questions now. So let me see if I can just access the chat. Okay, so someone asked, what are CPD activities? What does CPD mean? So good question. CPD means continued professional development. So it's essentially like any kind of training training that you engage in, whether it's at work, in a service, or by yourself, that is considered CPD. So actually, this webinar technically is also considered CPD. You just don't get a CPD certificate at the end. But it's anything that will kind of support your professional development. So, the BPS, I think, has a lot of CPD activities. There's a lot of really good organizations that offer it, but your workplace should also offer it as well. I hope that's clear. The next question, how much reflection would you suggest is needed in an AP application, especially when there is a tight 1,500 word count? Should an entire example model be worked through? Really good question. Thank you for asking this. So I would not recommend being too reflective in your statement, because as you said, the word counts are tight. So definitely don't weave in an entire model. It's just going to take up too much space. You need to just make sure that you're covering all the essential criteria and ideally the desirable criteria as well. So like if you wanted to, you could, depending on the criteria, you could use one example and then put like a very brief reflective sentence. So, let's say you're trying to address the criteria, knowledge of psychological models. I think that's one that comes up a lot. You'd kind of give an example of when you've used it. So, I developed knowledge of psychological models in my support worker role, working with individuals with depression using CBT. Okay, that's the example. And then after, you could just say something like, this taught me the importance of, or through supervision and reflective practice, this taught me the importance of pacing and adapting the intervention according to a client's needs. You can just leave it there. You don't need to be, because also the posts close. They're closing within like an hour or two now, so you don't have time. And the hiring panels know that as well. So I wouldn't worry about being too reflective. Like I was not really reflective, honestly, in my statement when I was applying. This was 3 years ago, but I imagine it hasn't changed that much. So someone asked, lots of advice when applying seems to be demonstrate how you use psychology. Would you recommend adding in psychological theories within the reflection? Yes, really good point there. Actually, maybe that's something I should have emphasized a bit more in this webinar. They do want to see how you are sort of using psychological theory to inform your reflections. So again, like this would be more so in an interview, but let's say you've got a challenging, the challenging case, that's just the most basic one. You could even use, the social graces is actually technically a systemic theory, so you could weave that into the reflection quite easily. Or if you're working with someone and you're using CBT, you could show them how working with thoughts, feelings, and behaviors and physical sensations, how that taught you something, whatever it is, how it kind of taught you the importance of looking at all the different components of a client's presentation or distress. Or even, kind of critiquing it. So let's say you're using CBT, you're bringing in that theory into the reflection. Maybe your reflection is actually that, I realize that CBT is a bit flawed. It's so focused on thoughts and feelings that we don't really cover anything from the client's past or their systemic background or environment. So there's no real formula in doing this. It's going to really depend on the case that you have or the scenario that you're bringing. But maybe I can write something about this actually, because I think it's quite an important point. So yeah, I hope that answers that question. It's Ankita.
Yes. Hi, Melissa. First of all, thank you so much for this insightful session. I mean, learning about various reflective practices is very new to me. I do have one question. Can I combine or like integrate various reflective practices, kind of like customizing it, or just like following one is enough? I hope this question makes sense.
It makes perfect sense. I think you can. I mean, I guess the models that I gave today, like what, so what, now what, and the Gibbs reflective cycle, like the what, so what, now what is basically like a shortened version of Gibbs. So I think in that sense, maybe it wouldn't make sense to sort of combine those because they're ultimately doing the same thing. But I think you could definitely weave in the social graces into both of those. I think ultimately what makes sense to you. So I wouldn't be too concerned about like following a model too closely, because sometimes I think even doing that can bring up a bit of anxiety, and it makes you worried about like, oh, am I covering everything? But I think after a certain point, once you start reflecting a lot, it just becomes more intuitive. You don't even need these models anymore. But I think if you're new to it, if you're just starting out, I would stick with either the what, so what, now what, or the Gibbs reflective cycle. And then if it makes sense to weave in like a social graces or another psychological theory, you can do that as well.
Thank you so much.
Sure. Any other questions before we finish up? I realize I've gone over time. Sorry about that. No worries. Okay. Well, it was really, really nice kind of delivering this session. I really enjoyed it. If anything isn't clear, because I'm very aware as someone, I tend to, like, things can come to my mind and then I kind of want to get it out there, but maybe it can sometimes be a bit confusing. So if there's anything that felt confusing, or you felt like, oh, like I'm just like really not clear on this certain theory or this certain point that you were trying to make, Melissa, like, please can you explain it to me? If you click on the QR code or you scan the QR code, you can find like a contact form on my website. So please feel free to reach out and just ask if, ask me to explain something further. I'd be really happy to do that. I know that it was a lot of information today. So yeah, I'm glad it was helpful for people though. All right. Well, take care, everyone. If people are based in the UK, I'm sure you're all feeling really relieved that the heat wave is kind of over. So I hope you guys can rejuvenate now. And I will see you for the next one. Take care, everyone. Bye.